Hi everyone, it's Jasmine, and today's video is about understanding diabetes. So let's learn something together today and let's get started. Now, what is diabetes? Diabetes is a chronic condition where the body cannot properly regulate blood glucose/sugar levels. More specifically, diabetes is caused by problems with insulin, which is a hormone that helps move the glucose from the blood into cells for energy. Now, if we take a look at the role of insulin in the body, insulin is made by the pancreas. It allows glucose from food to enter into our cells so we can use the nutrients as energy. Without enough insulin, or when the body resists insulin, blood sugar levels will rise and can lead to diabetes if not managed or lowered. Now, if we look at the types of diabetes, type 1 diabetes is characterized by autoimmune destruction of insulin producing cells, and it will usually start in childhood. Type 2 diabetes is when the body becomes resistant to insulin, which is often linked to lifestyle and genetic reasons. And then there's such thing as gestational diabetes, which develops during pregnancy due to hormonal changes, making it difficult for the body to use insulin and in turn raising blood sugar levels. While gestational diabetes is usually temporary, it does raise future risk for developing the disease. Common symptoms of high blood sugar include increased thirst and urination, unexplained weight changes, fatigue, blurred vision, and slow healing wounds. It's important to note here that some people with type 2 diabetes may have mild or no symptoms at first before the disease is detected. If we take a look at risk factors, there are a number of factors that can increase our risk for developing the different types of diabetes. Family history of diabetes is one of them, along with being overweight or obese. Having a sedentary lifestyle is a significant risk factor, along with having an unhealthy diet, so one that's high in refined carbs or sugars. In turn, these things all can link together, but having a high blood pressure or cholesterol can increase diabetes risk. And it's true that certain ethnic backgrounds, such as Indigenous, South Asian, African, and Hispanic, are at an increased risk for developing diabetes as well. Now, when it comes to diabetes, there are a lot of possible complications that make the disease even more important to manage. If it's left untreated or poorly managed, you increase your risk for heart disease and stroke, along with kidney damage, nerve pain and numbness, otherwise known as neuropathy, vision loss, so retinopathy, or poor wound healing and infections. One thing that I see commonly as a nurse with diabetics is the neuropathy, so the nerve pain and numbness that diabetics often will have, and that puts them at an increased risk for developing wounds as well. So if they were to, say, for example, have a rock in their shoe and cut their foot, because of this numbness, they may not recognize that they do have a cut on their foot, and then that puts the wound itself at an increased risk for infection, along with blood sugars affecting the ability for wounds to heal in the first place. It's for this reason why it's extremely important that we manage diabetes as best as we can to avoid these complications. Now let's look at managing diabetes and what that means. Managing diabetes can involve monitoring blood glucose regularly, so whether you have a semi-permanent blood glucose monitor, such as a Dexcom right inserted into your arm or your leg, wherever the doctor has recommended it. This is something that you can hook up to your phone, and you can monitor your blood glucose levels before and after meals to coordinate medications appropriately. During the management of diabetes, or even in a means of preventing diabetes, it is crucial that we're eating a balanced diet that's rich in whole grains, fruits, and vegetables. Especially fiber-rich foods can have a significant role in lowering and monitoring our blood sugar levels. Of course, regular exercise is critical in managing diabetes, as it is critical in managing all chronic conditions. Taking prescribed medications or insulin, if that's applicable to you. Managing your stress and getting adequate sleep is essential, and attending regular health checkups, so making sure you're staying up to date on blood work and in the know of the function of your organs, along with the levels of blood sugar that are within your body and how they're being managed. Now, prevention ties in with management, but to prevent the acquisition of diabetes, we again want to maintain a healthy weight. We want to be active for at least 150 minutes a week, so that's just 30 minutes, 5 days a week, bare minimum. That can involve chair yoga, getting out for a nice walk, just getting your heart rate up to be able to burn off some excess calories and sugars. Limiting sugary drinks and processed foods is critical. Smoking cessation and not beginning to smoke as well. And then again, similar to management, getting routine blood sugar screenings if you have been told you're at risk, or just in general, at least once a year, trying to get an idea of where your blood values are at. Overall, diabetes is a common but manageable condition that affects how the body regulates blood sugar. With early detection, proper treatment, and healthy lifestyle choices, most people with diabetes can live full and active lives. Regular monitoring, balanced nutrition, physical activity, and medication adherence play vital roles in controlling blood sugar and preventing complications. Education, support from healthcare professionals, and consistent follow-up care are key to long-term success. Taking small, consistent steps today can greatly reduce the risk of serious health problems in the future. Thanks for watching.